Well, I have the esteemed privilege of being on the cleanup part. So a lot of the facts that I was going to present have already been presented, so I can really sum up pretty quickly. But it's been a great day of awareness and call to action on cancer prevention. So I'm from northern Michigan. Our health system, Munson Healthcare, services 27 counties, including the Eastern Upper Peninsula. So in line with Aaron today, it's a rural community, and our cancer care was fragmented. But to go back to what Nancy said earlier, in Grand Traverse County, which is the most populated area, we have the highest breast cancer rate in the state of Michigan. And the incidence is increasing over time to women under age 50. So it's a big question for us in northern Michigan why that is. Also, 14 of our 27 counties exceed the state poverty level. So that presents us with a lot of geographic issues and how to take care of people. Our doctors, our administrators had a vision philosophically over 2 years ago, and we opened the Cowell Family Cancer Center. We're privileged to have our biggest donor being Casey Cowell, who's the founder of U.S. Robotics, who's a prostate cancer survivor and who totally believes in health, wellness, and preventing further recurrence. So that's where it all began. Katie, my colleague, used to work with me. She helped start all of our integrative programs at Cowell Family Cancer Center. I knew I wouldn't keep her long, but it's been a great, great ride. So we have a vision of prevention, of diagnosis, and preventing recurrence. So from a prevention standpoint, it's all about perception. The American Society of Clinical Oncology did their first ever consumer study on what people feel causes cancer. And of course, they picked tobacco, and of course, they picked sun exposure. But nobody addressed obesity, and nobody addressed lifestyle. And so we know, again, what less cancer does, we have to take care of that and address it, because they are the major risk factors. So in our communities in northern Michigan, in our community health disparities, tobacco, smoking, obesity, and substance abuse are our biggest challenges. So from an obesity standpoint, our health system now is embarking on a campaign called Choosing to Be Healthy. And so we're tapping on that for our cancer program. So we started a 12-week appetite awareness program that's open to the community, to the survivors, and to active patients. And we did a pilot. And the outcome of that pilot was that folks had better energy, they slept better, they had improved physical health, more self-confidence, and their ability to eat a healthy diet. That shouldn't be just for cancer patients. That should be for our community at large. So we're really partnering with schools, with the healthcare system, with the Community Department of Health to roll these programs out. Now, tobacco use is big in northern Michigan, and Aaron even alluded to that in the Virginia area. So of our 9 hospitals, we do low-dose CT screening for high-risk patients. So we've been rolling that out in the 3 years that I've been there, but my worry always was, okay, so we roll out low-dose CT screening, and then what do we do for people? So we finally received a grant from the Association of Community Cancer Centers and certified 2 nurses to also develop a smoking cessation program. So we're now rolling that out the full year, but a little small town of Cadillac, Michigan, happened to see it in the Record Eagle, which I think that's how Bill found us, was some article in the Record Eagle. And they said in their business, would you bring that program to our business? Because I really want our employees to realize how they can stop smoking. So we did that through the Christmas holiday, and there were 22 people that signed up, and to right now, 6 have quit smoking. So that was good. And then the other thing that we have at our cancer center that Katie was instrumental in starting is a boutique. So it's part of our health and wellness suite, and we really wanted to sell products that were toxic-free. So in our Essentials boutique, we have skincare products for folks that have reduced toxicities. Then we looked at diagnosis, and we really had to rally about the treatments that we provide. We talked about poisons and toxicities, and chemotherapies are poisons. And so what do we do to help people get through that? So another part of our health and wellness services is we offer a lot of integrative therapies. So, for example, we offer exercise and body work. So it includes yoga, massage, and Katie introduced me to other ones, shiatsu, acupuncture, and meditation. We have a resource library that we wanted to be in our community the source of truth. So we have a physician champion group that reviews all of our resources so that they're evidence-based, so that what we're distributing to the community have facts to them. Our healing environment was really important. And today, 2 years later on our satisfaction surveys, we still get told that it's a calming environment. So we really wanted to carry that on. We have a partnership with a renowned organization called the Interlochen Center for Arts. And so they bring in students, and they started a health aesthetics program. So students are learning how to interrelate with folks with illness and introducing art into the center. So that's been very, very well received. And then finally, it comes to recurrence. So today there are over 15 million survivors in the United States, but we conducted focus groups in our rural area, and the biggest concern for survivors is the fear of recurrence. So what can we do to help eliminate that fear? There's a lot of medications, a lot of things we can do scientifically, but there's also the emotional component to help people that have beaten cancer and what their risk of recurrence is. So we're going to be working on more areas to really help reduce that fear, to provide those supportive services, but more research is done in that area. I like to see the psychologists, those of you that want to become social workers in the rural world. Nancy alluded to this earlier too. Support groups are key. People build strength off of each other, and so that will help us in our fight for recurrence of cancer as well. One of the references that I used today was the Lancet Oncology. It's got a 5-part, really good articles about cancer prevention and really significant details of what you can do, especially young consumers of the world when you're making food choices and going out and partying with your friend choices and those types of things, and where you should go and pay attention to those concerns. So I can't thank Less Cancer enough. It was a great exposure to me to understand. I've been so much on the treatment side of it, what to do on the prevention side and then the recurrence side. And I can't say enough how we're thrilled that the bicycle ride that we can sponsor with Less Cancer, so it ends in Traverse City with our cyclists there. So thank you very much.